Welcome to the video on how to find a designated prescribing practitioner in Bath. As always, folks, subscribe, like, and share, and let's get into this video. In this video, we are going to be looking at how you can find a designated prescribing practitioner in the wonderful city of Bath. Now, as always, before we get into this, I would like to highlight to you some key things. The independent prescribing course is also known as the non-medical prescribing course or the V300 course. This is a course that universities offer, and at the end of this course, you are essentially able to prescribe in an area that you are already have the experience in, but require a legal certificate to be able to prescribe in. That's the key thing to remember, that this course itself is designed to test your competencies. It is not designed to teach you how to become an expert in a particular condition. Because at MEDLRN, we always get asked this question, how do I choose which area that I'm going to prescribe in? I have a passion for diabetes, I have a passion for hypertension. That is fine. But at this current moment in time, what kind of patients are you actively seeing? What kind of patients are you actively advising? What kind of patients are you actively prescribing for? And that doesn't mean that you're writing a prescription. It could be over-the-counter medication. It could be lifestyle advice. It could be social prescribing. So that's the key thing. When you're choosing an area that you undertake your prescribing course in, and it can be one area, it could be broad, but narrow enough to have a select patient. For example, let's say you decide to choose diabetes. Now, prescribing for diabetics is huge. Are you dealing with type 1 diabetes or type 2 diabetes? So define. I'm looking to prescribe in type 1 or type 2 diabetes. Are you dealing with patients who have comorbidities? Are you dealing with patients who are pregnant? Chronic kidney disease. You might say, actually, I'm looking to prescribe for patients with type 2 diabetes during the initial diagnosis, or I'm looking to prescribe for patients who have been initially diagnosed with type 2 diabetes with no other comorbidities. But something like hypertension, for example, or rather diabetes, is a metabolic disorder. So people with diabetes do normally have hypertension, high cholesterol, obesity, kidney issues, microvascular conditions. So again, it can be quite challenging. So you need to ask yourself, the condition I'm looking to prescribe in, am I already well equipped? Do I have the knowledge? Do I have the practical experience to prescribe in this area? So this is not a course that teaches you to become an expert in an area. It's a course that you choose to do your prescribing in to demonstrate that you're already competent. Key thing to remember. So to put it simple, nurses, step one, where are you working? If you're working in a hospital or in general practice, ask yourself, what types of patients do you see on a daily basis that you are actively involved in? That doesn't mean that you've got a patient, you refer to your GP. No, it means I'm seeing this patient, I'm advising this to this patient, I'm able to explain to them what medication they need, I'm able to explain to them what the diagnosis is. The only thing the GP is doing is writing the prescription, but I do everything from start to finish. That's the key thing. If you're a pharmacist and you work in community pharmacy, it might be ENT related conditions because you see a lot of it over the counter. It might be skin related conditions, but it's not going to be diabetes. It's not going to be hypertension, because as much as you're measuring blood pressures, you're drawing bloods, but that's pretty much your scope in that setting. It's not that you're not capable, it's because you're not actively involved in the next stages. So pharmacists in community pharmacy, I'd recommend ENT related conditions. I'd recommend doing something like skin related conditions, might be useful for you. If you're working in primary care or hospital, then you can think about which areas you're competent in. That's the key thing to remember. So the course is a 6-month course. At Bath University, it's a 6-month course. The course itself at Bath, and we're focusing on finding a designated prescribing practitioner in Bath, and I'll come on to that in a moment. It's a 6-month course. It requires you to have a designated prescribing practitioner in place already. And a designated prescribing practitioner, also known as a practice assessor if you're a nurse. And nurses, keep in mind that you also need a practice supervisor. We'll touch on that in a further video. But essentially, if you are looking to undertake this course, you have to find and make sure that your regulatory body accredits Bath University's course. So if you're a pharmacist, go on the GPHC website. If you're a nurse, have a look at the NMC, and you'll find a list of conditions, or rather a list of universities that are accredited by your regulatory body. Make sure Bath is on that list. 6-month course. You need a DPP, also known as a Designated Prescribing Practitioner, in place. And this is the individual who's going to be mentoring you, making sure that you meet the competency framework, and is going to help you to make sure that you can navigate yourself through the course itself. That's the key thing to remember. And there's a lot to do on this course. Because not only are you going to be having, and you can see my mind is actually thinking, because there's a lot on this course, is that you have to do a OSCE, you have to do an oral presentation, you have to do a written exam, pharmacology based, you have to do a portfolio. As I've already mentioned, there's going to be essay in place, and you may also have to do a pharmacology related exam and treatment plans. So you can see there's a lot that's happening in this course itself. So be prepared for academic study. An academic study doesn't have to be difficult. Doing your independent prescribing course in Bath University is not difficult. And again, when I'm using the word independent prescribing course, it also means the V300 course, and it also means the non-medical prescribing course. It means the same thing. But you have to prepare in advance. Get in touch with the university, ask them, what am I expected to do for this course itself? How can I prepare for this course? I'd recommend speaking to friends, colleagues who've already done the course. And if you're not sure, get in touch with that MEDLRN. We can put you in touch with students who've already done it. Dedicate time. I'd recommend anywhere between 30 minutes to an hour a day is more than enough over 6 months. It's a 6-month course. And it's normally done remotely, so you don't have to attend, but there's a couple of classes you might have to attend. And then it's all about finding this designated prescribing practitioner for you. And how you can find one. Number one, I would recommend that you check with your contacts and check in your network. Number two, I would get in touch with Bath University and say, look, can you recommend anybody? Do you know anybody, or do you have any links? And again, remember, every university should be not navigating you to a particular service, but probably will say to you, actually look in your locality or so on. So keep in mind, if they are recommending an individual company, make sure that that organization has taught your profession before. There's a contract in place. I'd recommend an experienced professional. So I'd recommend sticking to a doctor who's been qualified for at least 3 years, has experience within your scope of practice, and you can have that conversation with them to explain how essentially they're going to support you. Key thing to remember, you need to have that dialogue and that conversation. It's not just about finding someone, it's about finding the right person. If that doesn't work, then I'd say get in touch with the local hospital. See if there's anybody or there's an NHS trust that you can speak with. Perhaps even the PCN or the ICB could be quite helpful for you. If none of those two work, then I've got a super solution for you, and that is LinkedIn. Go onto LinkedIn, start building your network, start making connections, introduce yourself, and say you're looking for someone to act as a mentor. And if all fails, but you've tried everything else, you can get in touch with MEDLRN. We'll be happy to support you, not only while you're on the course, but after you qualify, so you can expand your scope of practice. We have a wide range of CPD courses that can help you expand your scope of practice from start to finish. If you're struggling to find a DPP in Bath, or you want to expand your scope, or maybe you just need some advice, get in touch with MEDLRN. More than happy to help. Thank you for watching. Welcome to the video on how to find a designated prescribing practitioner in Bath. As always, folks, subscribe, like, and share, and let's get into this video.